Chapter 53. Helping Older People. Nothing is more certain than the passage of time and the changes that come with it. Whether we like it or not, we are all growing older every day. Naturally, we all wish we could stay young and full of energy, but this we cannot do. We must therefore find ways to adjust our minds even as nature seeks to adjust our bodies to the changes of time. What makes a person grow old? This has been the great question in the minds of medical students for a long time. Today we know some of the reasons why these changes occur. With delicate instruments we can even measure some of the more obvious changes. But we still do not have the complete answer. Before drawing too many conclusions, we must await the further findings of modern medical science. We are all aware of the enormous changes occurring at puberty, between childhood and adolescence. As explained in chapters 26 and 47, these are largely due to the increased activity of the endocrine glands. We are also well aware of the changes occurring in the menopause, or change of life. These are probably due to the lowering of certain hormones in the bloodstream, as discussed on page 536 and 583. This gradual lowering of sex hormones may alter the level of other vital hormones and enzymes, and thus prepare the way for marked changes of later life. Is there any way of turning back the clock of time and preventing these changes from coming on? Unfortunately not. But we can do much to delay this process by making it a lifelong habit to choose the right diet. We must also learn to live sensibly, taking sufficient rest and exercise, and avoiding those things that break down the body's resistance to disease. These principles have been the theme and purpose of this book. There is nothing new about the desire to stay young. Years ago people wore special charms or went on pilgrimages to various shrines to keep themselves from growing old. But the story was always the same. Eventually they died, usually at the same age as their parents did. Hereditary influences are very strong in determining the length of a person's life. Today many people are looking for some magic pill or tonic, or a series of injections, or even an operation that might help to prolong their years. So they run from one doctor to another, hoping to find something that will keep them young and vigorous a few more years. This often serves a useful purpose, for many older people are found to be suffering from mild cases of heart disease, high blood pressure, diabetes, and other conditions, all of which can be successfully treated when discovered in time. But regardless of all we may do, the passing of time always brings subtle changes that cannot be ignored. Take a good look in the mirror and you will probably see some of these changes taking place in yourself right now. But this is no reason for discouragement. Those extra lines often add a richness and character to the features never seen in our younger years. Fortunately, there is no sharp dividing line between one period of life and another. The years of maturity steal upon us unawares. Changes in old age 621. And most of us are scarcely conscious of the passing time. But sooner or later we must all face up to the profound changes that lie ahead. And before doing this for ourselves, we may have to help some of our loved ones during the closing years of their lives. Not that we should try to prolong their lives, for often they are suffering and would rather be at rest. But it is our responsibility to make their remaining days truly happy and satisfying. Be optimistic. So much depends on the attitude of the mind. Many years ago the wise King Solomon noted that a merry heart doeth good like a medicine. Those words are just as true today. A cheerful, optimistic outlook is of the greatest importance in helping to face the infirmities of age. How refreshing it is to find some elderly person still managing to live well in spite of some real infirmity. How sad to find another with some minor illness just about to give and die because of depression and discouragement. Successful living usually depends on choosing a suitable diet, keeping vigorous and active, securing sufficient sleep, and maintaining 622 helping older people. A wholesome attitude toward life in general. Younger people should always encourage those older in years to think young. Help them to look on the bright side of life in spite of pain and disability. An optimistic attitude is the first and perhaps the most important step toward better health. Watch out for danger signals. Many serious conditions may be first noted during the later years of life. All of these are more fully discussed elsewhere in this book. Here they are only briefly mentioned so that nothing will be overlooked in considering the problems of an elderly patient. Hardening of the arteries. Although this condition is common in later life, it is not a normal part of growing old. Years of neglect, plus a poor diet and bad habits of living, often precede the onset of arteriosclerosis, or hardening of the arteries. Many who suffer from this condition are or have been grossly overweight so that fatty deposits are found in the walls of many important arteries. This condition is the chief cause of strokes and heart attacks, is often inherited and is far easier to prevent than to cure. All younger members of the family should realize that hardening of the arteries often begins early in life. They should become aware of the danger and do their best to follow a balanced program of living from their earliest years. For further suggestions concerning arteriosclerosis, see page 263. High blood pressure, or hypertension, usually comes on during the middle and later years of life and is often associated with strokes and heart disease. Its most serious complications can often be avoided by following a lifelong habit of sensible living. Suggestions for treatment are found on page 247. Strokes are very common during the later years of life. Small strokes usually cause very few symptoms. But if they occur too often, they may lead to marked changes in the patient's ability to think normally. A large stroke may leave a person more or less paralyzed for the rest of his days. Most of strokes arise from a thrombosis, or clotting of blood in one of the vessels leading to the brain. If this occurs in one of the larger vessels of the neck, the clot can be removed by surgery, and the patient may then make a complete recovery. Unfortunately, we still danger signals in old age 623 have no way of removing clots from the smaller vessels within the brain itself. Sometimes a small artery in the head will rupture, possibly because of high blood pressure. This may then cause a serious hemorrhage inside the head. The trouble may arise from a weakness, or aneurysm, in the wall of the vessel. The resulting hemorrhage may then badly damage the brain. For more complete details concerning the treatment of strokes, see page 504. Heart trouble is the greatest cause of death today. The first sign of trouble may be nothing more than a steady rise in the blood pressure, followed by heart failure. Doctors call this hypertensive heart disease. If there is a marked narrowing of the vessels in the heart wall, the condition is known as coronary artery disease. The patient may then begin to suffer from angina pectoris, or sharp pains over the heart. Later he may actually develop a true heart attack, or coronary thrombosis. However, pains in the chest are not always due to heart trouble. Other conditions such as arthritis of the spine, costochondritis, or inflammation of the anterior chest wall, radiculitis, or nerve inflammation, pleurisy, pneumonia, and many other conditions may also cause pains in the chest. These are all different from true heart disease and are discussed elsewhere in this book. For more details concerning heart trouble, see chapter 30. Leg ulcers and varicose veins are also common in older people. Wherever possible, it is wise to have the large, twisting veins completely removed by surgery. This is always the most satisfactory treatment. Smaller ulcers of the legs may then heal without further surgery. Larger ulcers may need to be covered with a skin graft to promote healing. Arthritis is often seen during the later years of life. Swelling and pain may occur in the fingers, wrists, shoulders, spine, hips, knees, ankles, and toes. Any weight-bearing joint may be involved. Much can be done to help arthritic patients. Hot moist packs will often relieve the stiffness and pain and help to make life easier for the patient. For a more complete discussion of arthritis, see pages 456 to 459. Glandular troubles. Many older people are troubled with itching, dizziness, hot flashes, and other distressing symptoms. Most of 624 Helping older people. These arise from endocrine changes in the body. Hormones are often the answer to these troublesome conditions. Older ladies may benefit from the use of female hormones, while older men may need male hormones to keep them well. A combination of both male and female hormones may help to prevent some serious aging problems, such as osteoporosis, or thinning of the bones. For a more complete discussion, see the chapters on hormone conditions. Urinary problems are always more common in later life. Because of weakness in the sphincter muscles of the bladder, some elderly women may have difficulty in holding their urine. Gently dilating the urethra with a suitable instrument will often relieve this condition. Sometimes more extensive procedures are needed. Elderly men may have difficulty in passing their urine because of an enlarged prostate gland. The gland should then be removed by surgery, preferably by using the transurethral approach. Urinary infections are more fully discussed in Chapter 49. Diabetes may come on in later life, and is usually rather mild, so that it may not be recognized until a person has routine medical examination. Fortunately, this form of diabetes is easier to control than the juvenile type that occurs in younger people. Most elderly people respond well to the newer anti-diabetic pills, as suggested on page 552. Digestive disorders. Many older folk suffer from gas and distension of the stomach and intestines. This is often aggravated by nervous tension, probably because in that condition the patient is swallowing large quantities of air without realizing what he is doing. He may also have achlorhydria, which is a lack of hydrochloric acid in the stomach. Many older people fail to drink enough water to keep the contents of the large bowel from becoming hard. Constipation naturally results. Merely increasing the intake of water, and using bulky foods such as vegetables in the diet, will often relieve the problem completely. However, all patients with digestive trouble should have X-rays of the stomach, gallbladder, and intestines to rule out more serious problems. Older people should be careful not to use high enemas and harsh laxatives too frequently, for these may cause trouble in the colon. They should also have a careful examination of the rectum at least once each year. Cancer may strike at any time of life, but it is always more common during the later years. Any chronic sore appearing on the nursing care 625 face, head, or neck could be due to skin cancer, and should be removed by surgery. Cancer may also occur in the stomach, rectum, breast, and genital areas. Cancer of the lung or bladder is always a possibility, especially in heavy smokers. All these conditions are discussed in other parts of this book. They are only listed here for easy reference when considering the health of an older person. Choosing a good doctor. Every family needs the counsel and guidance of a good family physician on whom they can depend at all times. Do not wait until someone is very ill before finding a good doctor for your family. The more he knows about you now, the better he will be able to serve you in time of need. Many serious illness can be prevented or relieved when recognized and treated in time. The doctor you choose should be well trained and well accepted by the doctor physicians in your community. He should be a man of character and discretion. His advice will mean much to you, and his presence will bring comfort and strength in times of severe illness. Why not get to know him now rather than waiting until too later for him to give you the help you need? Selecting a nursing home. When an elderly patient is no longer able to care for himself, the younger members of the family have some real decisions to make. Every true son or daughter naturally wants to do what is best for their aging parents and loved ones, but how can they know for sure what to do? Wherever possible, older people should be allowed to remain in their own homes as long as feasible. Some may need the services of a housekeeper or companion, or some help in getting their meals. Be careful not to restrict their activities too much. Keep the older person vigorous and active, and this may help to avoid some of the more serious complications that so often arise from inactivity. Eventually the time may come when nursing home will have to be considered. What kind of a place should you choose? That naturally depends on the type of patient. Those who are up and about can usually get along with less expensive care. Bedridden patients may need the services of a trained nurse to supervise their treatment. Others may do well with the help of an attendant. 626 Helping older people. Whether the patient is in a convalescent hospital or cared for at home, there are certain things that must always be watched. If he is bedridden, great care must be taken to prevent bed sores. These usually arise because of prolonged pressure on the bony prominences of the back, and also on the heels and sides of the ankles. Bed sores are often slow in healing and are a constant source of infection. Paint the ulcerated area with compound tincture of benzoin and apply an infrared heat lamp for about 20 minutes 2 or 3 times a day, as suggested on page 103. This will often help to heal bed sores, provided the patient still has an adequate circulation of the blood. After the infrared treatment, apply neomycin powder and cover the ulcer with a clean dry dressing. Some infections respond well to the use of ultraviolet lamp, but one must take care not to burn the skin. The elderly patient's diet is also important. His meals should be well prepared and attractively served. If he cannot chew his food properly, see that it is cut up or pureed so that he can get all the nourishment from his meals. Suggestions for comfort. Before finally choosing a nursing home, it is always wise to talk the matter over with your family doctor. He may have several places to suggest. You should also take a good look at the condition of the room and the furnishings to be sure the patient will be comfortable and happy in his new surroundings. Try to provide a pleasant view of lawns, flowers, trees. If he can walk or ride in a wheelchair, see that he is taken out in the sunshine frequently where he can enjoy the beauties of nature and forget his problems for a while. If no suitable rest homes are available, there may be no other choice than to have the patient reside with different members of the family, perhaps spending part of the year with each one so that all will share in the responsibility. This may be less expensive, but there are drawbacks. For in drifting around from one place to another, some elderly people may begin to feel they have no home of their own. Elderly people should always be allowed to live their own lives as much as possible. Encourage them to be independent, doing all they can to help themselves. Do not be too annoyed if they sometimes seem childish and refuse to follow your instructions. Just give. Caring for the elderly. 627. Them a little time to think things through. By being tactful and kind you may persuade them later. Elderly patients who are mentally ill should always have the help of a qualified psychiatrist. If agitated or depressed, they can often be helped by the use of suitable tranquilizers. But these must be prescribed in the right dosage to meet the individual patient's needs. Caring for an elderly patient is not always easy. Often there are real problems to face. But whenever possible, it is wiser not to make an issue of these. Above all, try to make the patient feel that even at the end of his life he is still loved and wanted by those for whom he has done so much in past years. Honor thy father and thy mother was part of the divine law given to the human family long, long ago. It is just as real and just as imperative today as it was then, for with this commandment goes that same wonderful promise that thy days may be long upon the land which the Lord thy God giveth thee. Here is one of the most beautiful secrets of life. A true appreciation and love for our own dear ones and for all the human family will bring lasting joy and happiness, and will bring to all of us the deepest and most enduring satisfactions in life. Give me a good digestion, Lord, and also something to digest. Give me a healthy body, Lord, with sense to keep it at its best. Give me a healthy mind, good Lord, to keep the good and pure in sight. Which seeing sin is not appalled, but finds some way to set it right. Give me a mind that is not bored, that does not whimper, whine, or sigh. Don't let me worry over much about this fussy thing called I. Give me a sense of humor, Lord, give me the grace to see a joke, to get some happiness from life, and to pass it on to other folk. Asterisk written over 600.